Jazzcast Pros.
Welcome back to the Doze Podcast, where every week we dive into the fascinating world of sleep health, uncovering stories and solutions that inspire you to rethink the way you sleep. I'm your host, Kuczkowski, and today I'm joined by an extraordinary guest who's helping to bridge the gap between dental health and sleep wellness, Dr. Dar Radfar, known as Dr. Rad. Dr. Radfar is a graduate of USC School of Dentistry and is not only an expert in general and cosmetic dentistry, but also a pioneer in the field of sleep dentistry. He's a true inspiration in his dedication to pushing the boundaries in both dental and sleep health education and forging a path to empower others in his field to include screening for sleep disorders in their everyday practices. Dr. Radfar is passionate in educating both the dental and medical communities about the critical interplay between oral health and sleep disorders, emphasizing the importance of recognizing signs like bruxism and scalloped tongue as indicators of sleep apnea. In our candid conversation, he shares his insight on how integrating sleep apnea treatment into dental practices not only enhances patient care, but also builds stronger relationships within the medical community. So I want to start off just by saying I'm super excited to have this conversation with you today. When I met you and then I learned about the work that you're doing, I was just fascinated because we share a mutual passion for sleep and the sleep industry. But you yourself have this profound personal journey with your own sleep trouble. Can you start off just by sharing a little bit about that?
My journey started when I was 6 years old. I was escaping the country of Iran on horseback, actually, because that was the only way we could leave the country back in 1983. And one of the things that the people that were helping us escape shared with me and said, don't fall asleep. If you fall asleep, you'll fall off the horse and then you'll fall off the cliff. So that kind of message resonated for me since I was 6 years old. Don't fall asleep, stay awake. And so I've always had some sleep issues. And fast forward in 2009, ironically, I fell asleep at the wheel driving my car and I crashed into a tree going roughly around 35 miles an hour. Luckily, I walked away without a scratch, but that kind of allowed me to dive into this world of sleep apnea because I was feeling a little more tired throughout the day. I was told that I started snoring. I was only 32 years old. I'm 6 foot tall. I weighed 165 pounds. So don't judge a book by its cover. Usually people think sleep apnea and snoring is only associated with being overweight. And so I took a home sleep test back then and they gave me a CPAP machine and I couldn't tolerate it, especially because I'm a stomach sleeper. And just like many other people, I was like, what am I going to do? And so I discovered that there's a mouthpiece out there, and being a dentist, I was a dentist for about 8 years back then. And I was patient zero. I made my first mouthpiece for myself. And of course, it changed my life. And since then, I've made a couple thousand of them for my patients that travel from all over the country now to see me here in Thousand Oaks, California. And it's a game changer in many different aspects. And we'll dive into that, I'm sure. But that's a personal story that I experienced. And hopefully people don't experience it the harsh way by falling asleep at the wheel and crashing their car. And there are other ways that we'll talk about that you could self-assess and get treatment.
No, absolutely. There's a story that I tell about a physician that I knew that a similar story happened, and luckily she walked away as well. But it's something that just doesn't get enough attention, especially in the healthcare space, right? The long hours that you're working, the toll that it takes on your own sleep. But you yourself, you've been a pioneer in this area because I've been in sleep since 2006, and I've been talking about, oral appliances or what we call mandibular devices for a number of years. But it's really only gotten a lot more attention over the last couple of years because of COVID and because, there was a recall on a number of CPAP machines, which is continuous positive airway pressure. So that's kind of like the mask and the machine that everyone's kind of scared to use, or they tend to be non-compliant. They don't necessarily like to use it like yourself. So this is an alternative therapy, which is now, it's regulated, but it's really taking more mainstream in terms of treatments for sleep apnea. And I know there's hundreds, if not thousands of devices at this point. Can you speak a little bit to the advancements in these types of devices and which one you particularly carry in your practice?
Well, a custom fitted appliance is really the best way to go. And that custom fitted appliance can really only be done if through a dentist. No medical doctor can do this appliance for you. And I train dentists on how to do this. I've trained a few thousand of them now, as my passion to push the narrative forward is the more we help dentists understand how to make these appliances, the more patients they can help. And my favorite appliance is the Sleep Herbst appliance. It's been around for decades as an orthodontic appliance and really Medicare approved, FDA approved since 2010. And there are other appliances, the Ervada, the Prosomnus. There's a bunch of appliances out there that are a little bit more lighter weight. I just believe the Sleep Herbst is a little more durable. Mine lasted 9 years before it fell apart. And on average, I'm seeing them last anywhere between 3 to 5 years on my patients since I've been delivering them since 2010. So I have a pretty big pool of patients that have been using it. And easy to adjust, especially if like a patient needs a new crown or anything like that, or a new restoration. You can easily adjust this appliance, the Sleep Herbst appliance, to make it fit to the new crown, so you don't have to end up having a new appliance made and going through the impressions and the cost and whatnot.
Just as a side note, because I know in your practice you focus on TMJ as well, and I myself suffer from that, and I wear a guard for that. Do you have these devices where they have that multifunction, where for the sleep apnea and for that as well, and your patients have found success with that?
Yeah, and the Sleep Herbst gives you freedom of movement to move left and right, and even open if you need to, in case you can't breathe through your nose. So by bringing the jaw slightly forward and keeping it that way doesn't mean we have to hold you there like the tap appliance does and just doesn't allow you to even move left and right. And so we want a little bit more freedom of movement. And, majority of TMD or TMJ patients with temporomandibular disorder are airway patients. They're struggling for air when they can't breathe, and the jaw clenches, tightens up in a fight or flight response. And most of these people bring their lower jaw forward. So a clear sign of a patient who has TMJ problems and as a result, possibly from sleep apnea, is lower anterior wear or the front teeth wearing down. And also some pitting of the molars because of the acid reflux that can come up and when the teeth slam against each other when we clench down. And there's a lot of patients like that come into a dental office, and we're just making them night guards. and we're not even looking at or talking about the medical comorbidities that are associated with sleep, meaning what medical conditions are because of the sleep disorder breathing, and also other dental conditions as well. So if you're my TMJ patient, the first thing I would ask you is, you're telling me, I feel my jaw's tight, popping and clicking. How well do you sleep at night? Anyone tell you that you snore? Do you get up to go to the restroom frequently at night? Have you been dreaming when you sleep? So it's kind of like a self-assessment and asking the patient to see if we may need to go through a home sleep study first so that we can make an appliance that's just not an appliance that helps protect your teeth like a hard night guard, but also something that can help protect your teeth, plus open up your airway so you're clenching and grinding less, and also keeping the jaw in a stable position.
And I know that your business is multidimensional, because I work with a handful in my area, because we have very far and few limited sleep dentists that focus on this area. Sleep specialists in general, there's a minimum number of individuals throughout the United States that can help with this. But I know in your business model, not only are you working on the devices and on the screening, on the education component, but you've developed a line of supplements. And I didn't realize that you had one specifically for TMJ. And as I mentioned, I have issues with that. So it caught my attention. Can you speak a little bit to that? Because obviously those things go in tandem. A lot of times people don't understand how it can exacerbate. And you talked about acid reflux. So can you talk a little bit about those supplements and how they can help patients in those areas?
Yeah, my name being Dr. Radfar, the kids at the office, ever since I've been a dentist, call me Dr. Rad. So everything that I've created has a rad influence. And when sleep apnea kind of hits you, there's other factors that may cause you to sleep poorly. One of them is insomnia. And so when COVID happened and all my patients that would come in, they're like, "Doc, the mouthpiece is great. I'm not snoring, but I can't shut this brain up. I'm nervous. I'm anxious. I don't know what to do about COVID with respect to my mom, and my grandma's living with us, and work and this and that and school, and kids were on Zoom and all these things that we were balancing." And doc, I'm taking Tylenol PM, I'm taking Advil PM, I'm taking Xanax, I'm drinking 3 glasses of wine, I'm taking, in California here, marijuana gummies. And so I realized that so many people are taking these sedatives, and they're not natural sedatives. They're sedatives that could be liver and kidney toxic or kidney toxic. So my biochemistry background kicked into gear, and I created my first supplement called RADZs. RADZZZ was really created to not only help you fall asleep and stay asleep with things like L-theanine and valerian roots and tryptophan found in turkey when we have Thanksgiving dinner, but also it has a certain ingredient called N-acetylcysteine. And NAC, or N-acetylcysteine, if you just Google NAC and sleep apnea, you notice that it lowers AHI, or apnea hypopnea levels, that's measured on a sleep test, how many times you stop breathing and have shortnesses of breath, by about 30%. That supplement by itself, called NAC, does wonders for clearing the mucus in the airway. And in conjunction, the anxiety that people are having, people are clenching and grinding their teeth. So the muscles are tightening up. So I dived into creating Rad Jaw. So after RADZs, Rad Jaw came into play because, again, people were so stressed and dealing with the anxiety of clenching their teeth. And Rad Jaw has things like magnesium to soften the muscles, MSM, chondroitin sulfate, glucosamine, vitamin D3, calcium. And these blended together help, and also some fish oil, helps soften up the tense of the tactile, the tenseness of the muscle, and also help with the popping and clicking because of the chondroitin sulfate and glucosamine. Together, the RADZs and the Rad Jaw, taken 20, 30 minutes before bedtime, has shown to really naturally help people fall asleep and stay asleep, and also breathe better, clenching and grinding their teeth less, and rehabilitating their joints internally, naturally.
So it's something that would take in tandem. And then I'll drop the link down below, but can you just share your website where, if people are interested in that, they can purchase it?
Rad Health, INC, radhealthinc.com. It has all the supplements that I've created.
To backstep for a moment, I briefly talked about the fact that we don't have a lot of individuals that actually work in this space. And that's how I met you. I actually met you in line at a podcast conference, and it was kind of kismet, right? Because we're the only 2 people there on sleep, and we happened to just strike up a conversation. And I loved hearing about the fact that you have a certification program for dentists that focus specifically on the sleep component, because there is such a lack of training. I mean, dental sleep medicine is now starting to evolve. There is an annual conference and different CEUs. But can you speak a little bit about the program that you offer, and then share some information about, if we have some dentists listening, how they can get involved with screening for sleep disorders in their practice?
So there's 2 reasons why dentists should treat sleep. First of all, let's be real. To add to your EBITDA, I mean, on average, the dentists that I've trained add about $250,000 first year to their practice. If you exit somewhere between 3 to 5 or 7 to 10, if you're a DSO, you could do the numbers. It's over $1 million added to your EBITDA. So there's a financial gain here. And for a $375 appliance that you usually typically get cash fee somewhere between $2,500 to $5,000, and some people are charging more, but I'm kind of in that $3,000 price range. The ROI is there. So if financials is your motivation, and look, we have to speak frankly here, it's definitely the biggest game changer that you can add to your practice. And again, $250,000 that's if you're doing 1 appliance a week. And I show dentists how to make way more than that, but that's just the bare minimum. To learn it, you got to know how to, first of all the basics, the definitions, the impression, the bite, what to look for, how to refer for a home sleep study, what to look for in the medical history that correlates to sleep. For example, high blood pressure, acid reflux, depression, history of cancer, 5 times higher risk of cancer of any kind, the University of Wisconsin study, if you're not being treated for sleep, 12 to 15 years off your life from severe sleep apnea that's not been treated. 12 to 15 years off your life, 5 times higher risk of cancer, higher rates of heart attack and stroke, falling asleep at the wheel, depression. 46% of depression is associated with sleep apnea because of the lower production of serotonin. You want to talk about mental health. How can you get positive, happy-go-lucky people when you're sleeping and you're not breathing well? I mean, it's the rise of mental health, no matter what you journal, no matter how much you meditate, no matter how much you affirm gratitude in your life, which is huge in my life, and I strongly believe in it. Every night I go to bed and every morning I get up. If you're having apneic events and your heart's racing to get oxygen into your brain, you're a dentist, you could help these patients. And so I train all that through my course, and the course is 1 full day long course. It's virtual. And then the biggest thing that I do differently is I coach and consult you for 6 months after. And I'm the only person out there that I'm aware of that guarantees that you will succeed. I mean, I won't take you on if I interview you. I make sure that your practice is definitely ready and set go to do sleep. Even if you've never done it before, within the first few weeks, you're making your first appliance, and I show how to get referrals from medical doctors, no advertising, no cost to you with respect to putting Facebook ads and Instagram ads, and you could do all that. But just communicating with the doctors in the community what you're doing, and I show you how to do that, is part of the program. So not only do you have a wealth of patients within your practice that you need to look for that sleep and email them and target them and let them know what you're doing, but also there's medical doctors that they see that you're going to communicate that information to. So if you're my patient, so that and I saw you and you said yes to the sleep study, and you came back 2 weeks later and we reviewed it after I referred you to the company, which I teach all dentists on how to do this, and said, hey, you do have mild sleep apnea. And by the way, do you see any medical doctors in the last three years? And you say, oh yeah, actually I saw a cardiologist because of my arrhythmias and my high blood pressure. So I share that information with your physicians, all the physicians that you've seen, through a letter that I call Letter to the MD. And that's a little pearl I'm giving the dentists out there. And that message that I share with those MDs, they get these letters from me and they're like, who's Dr. Rad? And he's treating our mutual patient, and that's where I do the follow-up and go to their office and say hello and answer any questions that they may have and let them know this is what I do. And once in a while, I'll need a cardiologist or a primary care physician that I need to refer to because my patient that we screened has arrhythmias on the sleep study and they don't have a cardiologist and they should have that checked out. So I create this network and I teach that through RAD seminars. RADseminar.com is the way you can find out about the coaching, consulting, and the courses that I have.
That's amazing because, I mean, I always say dentists, and you in particular, you're a kind of a gatekeeper, right? Because everyone should go to the dentist. I mean, I get 2 cleanings a year, and I'm actually thinking of doing 3 cleanings a year, right? Because your dental health is so important to your heart health. All of those things are correlated. And, we always say the primary care physician should be screening, but we breathe every single day, right? We take 25,000 breaths in a day. And when you're going to the dentist, they can physically see what is going on. And there's also these limitations to going to a traditional sleep lab, being that I came from sleep medicine, they're really looking for that sleep apnea. In your practice, do you screen for the upper airway resistance syndrome? Because that's something we see a lot of where it's like you're negative in a lab, but you still feel like, you're not sleeping, you're not breathing well, and you know that you need additional help. And that's where a sleep dentist can really be that additional piece that you're missing.
Yeah, some of the landmarks that a dentist should be looking for, and this is part of the stuff that I teach, is large scalloped tongue. The larger the tongue, the less room you have for it it falls back. And so it kind of vibrates against the back of the throat. That's called snoring, or that suction against the back of the throat. That's called sleep apnea. So when you thrust your tongue forward, when you have an apneic event, it hits the back of the teeth. And so that thrusting forward pierces the tongue into the back of the teeth where the floss goes into. We call those the embrasures, right? And so that can cause literally piercing of the tongue. And that's called scalloped large tongue. A large scalloped tongue is a big landmark there. Mouth breathing can cause more dryness of the mouth. And so lower anterior tartar, or getting more buildup on the lower front teeth there, can be an indication of mouth breathing, which can be an indication of upper respiratory blockages. We talked about grinding of the teeth, lower anterior, where the teeth grinding forward, you're producing your own mandibular advancement or your own jaw moving forward in a CPR position, which is technically what the mouthpiece does. And that grinding of the teeth shows those lower teeth being worn down. There's a thing called malampati. You stick your tongue out. Don't say you just stick your tongue out. You do that in front of a mirror, or do it, have someone in your family or a friend of yours or someone at the office stick their tongue out. If you can see the whole punching bag, that uvula in the back, that means you're most likely breathing okay. But if you can only see the soft palate or very little of the uvula, that little punching bag in the back, then that means there's a high indication that the palate is more anterior or more forward, and there's a higher likelihood of sleep apnea. So there's a ton of things that you can look for in the mouth. As I said, acid reflux is 60% of acid reflux patients is when you have that extra respiratory effort, the gasping, so to speak, pushes the diaphragm up against the stomach and the acid comes up, and that sphincter called the esophageal sphincter gets destroyed. And so acid reflux hurts the teeth, right? So you have near the gum line, you get these notches that can be a part of the reason why those notches are happening. Or pits, the dentin is starting to show, meaning the enamel's worn off due to the acidity. And those are all possible reasons that sleep disordered breathing is happening. And so that's where the question just becomes. You got to get brave as a dentist, as a hygienist or a dental assistant. When you see these things, I just talked about 6 different things. We didn't even look at the medical history, and just ask, how well do you sleep at night? Are you tired throughout the day? Anyone tell you that you snore? Have you had any sort of medical issues like recently, like high blood pressure or pre-diabetic? Or how do you feel? Are you happy-go-lucky throughout the day? And, oh, no, my kids this and my work this. And no matter what they say, I still offer that, well, just so you know, nowadays I could refer you for a home sleep test because people think you have to go to a lab. I use the word home so people can understand, oh, okay, well, there's something at home I can do to check my sleep. Yeah, help me with that. And they may say, no, I'm good. And 6 months later, you come back, you're like, hey, you know what? My husband's actually been telling me I snore more now. What were you talking about 6 months ago? And by the way, they've got my email newsletter once or twice a month that talks about snoring and medical health issues and mental health with sleep issues. And so I touch and educate my patients as much as possible, if it's not just in the chair, but also through my email campaigns and my social media as well.
So in terms of patient education, so is it mostly when they're in the chair? Do you have any additional, I know you said you have a newsletter. Is there a book or any additional resources that you offer your patients?
So in new patients, and this is what I teach all dentists, because I've done this before in so many offices, new patients get a screener form. It's the 5th thing that they fill out, or 4th thing that they fill out as they come in. And it asks questions like, do you snore? Have you ever woken up gasping for air? How many times do you get up to go to the restroom at night? Do you dream? Have you ever fallen asleep while driving? To get the conversation going. And I would tell you, majority of the time, they're truthful answers, but sometimes they're not. It's crazy that in a dental office, they would fill out a form and not be truthful. You put that questionnaire in a cardiology office, they'll answer it truthfully, right? But it's still a conversation starter, at least to see, hey, that this person is check marking all the answers that say that we need to have a conversation. I need to share with them that I can help refer them for a home sleep test. And also then the treatment could be a CPAP, an oral appliance, which is on the prescription or the results of the sleep study that's given to you from the sleep testing company, that's signed off by a board certified sleep physician, because dentists cannot diagnose it. We can only screen, meaning talk about it, refer it for a home sleep test. In majority of the states, there's only, I think, 2 or 3 states now that don't allow you to refer as a dentist. You got to send them to a medical doctor, which is okay, because we send a lot of things out anyway, wisdom teeth referrals, endo sometimes, orthodontic care, but we still look at it and we still talk about it if we see a problem, right? So we still should screen, and the new patient gets that form. Existing patients, when they come in for a prophy or a crown or a filling, if you give them that new form, they're going to push back. They're going to be like, well, I'm just here for my cleaning. Why am I filling this out? That's when I recommend speak to the patient in the operatory. Tell them what you see that's associated with sleep apnea or possibility of sleep apnea. The hygienists and the assistants are huge. And I have like a 25-minute video in my courses that are just specific for that. So they know what to look for, and then they hand off to the doctor so the doctor can further explain the process of getting them tested. But the cool thing, sad and cool, is lately people are coming in, they're like, oh yeah, I've already had a sleep study. Thanks, doc, for mentioning that. And I hated my CPAP, so I'm good. Or I barely wear it. And I'm like, oh, really? Well, cool. I was right then. Your lower anterior teeth are wearing down because of sleep apnea. You already had a study a year ago or 2 years ago. So this number of sleep studies has skyrocketed. people are actually already in your office and you're a dentist and a hygienist or staff member. They've already been tested. You had no idea, but they had no idea that you'd treat this. And so I have the brochures in the office that I provide. I have a big poster in my office that also of a person sleeping with their the wife is covering their ears, the bed partner, and the other end snoring, right? And they're like, "That's me and my husband. You help me with that?" I'm like, "Yes, I do. I mean, I've been helping for years, and sometimes they don't see the email or they don't hear the conversation. So the more you talk to them, the better. That's the best angle to be able to share with your patients what you know and what you do is offer them the information."
Well, that's interesting that you said about the home sleep testing, because I always say that, despite research and products and all these things that are accessible to the public, now home sleep testing has gotten a little bit easier, being able to use it multi-night, which I think is really important to getting a clear picture to someone's health. There's board certified physicians in different states, so you can do these things remotely and kind of get that additional support. But I think the big thing now, the push is the type of work that you're doing, where people realize that there are other therapies. That was one of the big things for me in the sleep lab, because there's different types of sleep apnea, right? There's positional sleep apnea, obstructive sleep apnea, central sleep apnea, complex, and if you don't understand the type of apnea you have, you don't understand the therapies that go along with that. And even if you have something like a CPAP machine or an oral appliance, it's not a standalone, right? It has to do with our lifestyle choices, behaviors and patterns that we engage in, what's known as like sleep hygiene. And the type of work that you're doing, you're opening up the doors to help people understand the type of therapies that are available. Because, I have on display, you can't see in the back corner here, but I have different types of oral appliances, CPAP machines, and so forth, just for education purposes. And people still don't even understand that there is such a thing as an oral appliance that you can wear for sleep apnea. It's new to them, because it isn't, unless you've really immersed yourself or you've gone into a clinic that takes the time to educate you on the different type of therapies that are available, you might not even know the options that are available to you, right? So I think this is a really important conversation, helping people understand that CPAP is not the only way. And COVID kind of blew the doors open for that, because now they're allowing this, where before there was a lot of pushback from sleep medicine in terms of using oral appliances, especially for those more severe, moderate to severe cases. But we're seeing that in those cases, compliance is better than having someone have it on their shelf, right? And not using anything at all.
The number of patients that are walking in through our dental practice, if you have 20 patients on average, just walk it in for any procedures. Let's say 8 of them are hygiene and the other 12 are a mix of dentistry that you do. It is estimated now that 30% of the U.S. population has sleep apnea. So that's about 6 patients who are walking in and out every day, 4 days a week, if you're working 4 days a week like the typical dentist. 6 times 4, that's 24 patients a week that have sleep apnea. Some of these patients have been tested, some haven't. And why are we shy and why are we afraid to get trained, which is the most easiest thing you'll do in dentistry? If you could place an implant, if you could do a filling, if you could do a crown, let alone, root canal, making a sleep appliance, the impression and the bite is like the ABCs of dentistry, and delivering it is also very easy. And so why are we hesitant to share that we are let's call it second line of defense? I still believe it's becoming the first line of defense because of the recall of 1.5 million CPAP machines that Philips had to recall two years ago, I think it's been now, because of the fact that the compliance is not as high as people would love to be with the CPAP. I mean, so if someone is recently single, right, and they sleep next to a bed partner for the first time, let's talk about the social ramifications. I mean, do you pack your CPAP and go over to someone's house? Or is it easier to take your mouthpiece? Or when they come over and, the husband and the wife in the past used to tolerate it, used to sleep in different bedrooms, sleep apnea gets more prevalent into the 40s and 50s and 60s. And unfortunately, especially in California, the divorce rate being over 50%, this is what I'm hearing. My patients are like, yeah, I'm embarrassed sleeping next to a new girlfriend or boyfriend of mine, because, after we were intimate, let's be real, they couldn't sleep. And maybe someone who you were with for a long period of time will put earplugs in, or was a heavy sleeper, or slept in the other room. Now they're stuck. So even if you are CPAP compliant, there are many times, whether you're traveling or camping or overnight flights, that the oral appliance can be a huge game changer. And, we could test the efficacy. I'd make you the appliance. After we dial you in, your snoring's less or gone. And there's apps to record your snoring if you don't have a bed partner that we check and you feel better. We do another home sleep study with the mouthpiece in and see the efficacy and try to move the appliance a little more forward if needed. And if not, where you hit a home run, we're good to go. And I check the appliance every 6 months, make sure all the screws and everything looks good, nothing's broken, nothing's cracking, and we move forward. But it's a big place for oral appliances because of the compliance. People are going to wear that more throughout the night. If you have to get up to go to the restroom, take the whole mask off, then come back, then put it back on, make sure it's sealed.
There's all these barriers to success, right? When you have to use a CPAP machine, people are less likely.
Compliance is the key. It's not just the delivery. And yes, central apnea, when it needs more oxygen being blown down your throat, but positional apnea, which is a lot of the sleep disorder meaning when you fall asleep on your back or when the jaw falls back, the oral appliance hits a home run with those types of cases.
No, absolutely. I love everything that you have shared today. And I know you have this program where you educate physicians or dentists who are currently in the space, but for the next generation, for those that are entering into the health field or getting into dentistry, what would the advice be to them from you about getting into sleep or focusing on this? Because I know I was with an academic-based sleep lab and we ran the fellowship program. So whenever we had our rotation come through, I'm like, okay, so you're going to do sleep medicine, right? And you're going to stay in the area. And they were like, no and no. So how do you inspire the next generation to not only, get into dentistry, but then really hone in on the fact that sleep is something that really needs a lot more focus?
I love this because I went to USC School of Dentistry, graduated in 2002. And about a month ago, they asked me to speak to the seniors about sleep apnea. And I asked them, I said, how much have you guys got education? They're like, we talked about it for like 30 minutes. And I was just like, wow. And then I've shared with them about an hour presentation and I just giving back to my, my former school. And one of the biggest points that they discovered that they learned, and they texted me after, I gave them my cell phone. I said, anything you need as a mentor, I'd love to help, is they didn't understand how big of a role they play in the health of an individual, the mental, the physical, the emotional, the social health of an individual that, one filling is not going to really have that much of an effect. Or an Invisalign case, sure, making the teeth look pretty and getting the bite right and hygiene better is great. But the reward, the return on investment and the return on life on taking CE courses and understanding how to do certain procedures right away, if you're graduating, it doesn't cost you much money to understand how to do sleep. It doesn't cost that much money how to understand to do Invisalign. Placing implants is a great thing. The more CE courses you can take and see what you like, what fits for your philosophy as a dentist, the better. So, I took Invisalign 6 months out. I took implants a year and a half out of dental school, and I've done over 1,200 cases of Invisalign. I've placed God knows how many implants. And sleep I dived into because of my car accident. So, don't let something happen to someone or to you to become a passionate advocate person to treat sleep. Come to radseminar.com and you can message me there and see some of the courses and webinars, free webinars that I host twice a month, and start learning about it at least and see. And then I could train you to become really fully licensed to treat sleep.
I love the work that you're doing, and I love the holistic approach that you're taking to this, because that's what it is, right? When everything that I do in my work, I say this is a lifestyle-driven brand because sleep is the foundation for everything: mental, physical, emotional health, our resiliency. And the conversation needs to change, and we need to change the way we view and prioritize it. So thank you for the part that you're playing in really opening this up and helping to educate individuals on how to get the masses screened and treated for this, life-threatening disorder. So I really appreciate you.
Thank you. Thank you very much for allowing me to. Remember, we see patients 2, 3, 4 times a year for their hygiene. There's no other profession in a health profession that sees so many different family members, coworkers, kids on a frequent basis. No other healthcare profession does it. that trust is built. And guess what? You're the only person, dentists out there, hygienists out there, that can look in an oral cavity, screen, and help with an oral appliance. An ENT can't help with an oral appliance. A physician can't. What awesome responsibility do we have here to pay it forward and help our patients live longer, healthier lives in their health, wealth, and relationships.
Absolutely. Thank you, Dr. Rad.
Thank you.
It's clear from today's enlightening conversation with Dr. Dar Radfar that the journey to better sleep isn't just about what happens at night. It's about understanding and addressing the root causes that affect your health round the clock. I want to again thank Dr. Radfar for sharing his personal connection and work in the sleep space, and for supporting others to share that message as well. And for our listeners, I hope this episode inspires you to think differently about your dental and sleep health. And perhaps if you've been putting off getting a sleep study or even given up on CPAP, that you consider exploring oral appliances as a new avenue for treatment. Remember, the right approach could be just a conversation away. And as Dr. Radfar illustrated, sometimes innovation in healthcare begins with asking the right questions. To learn more about Dr. Radfar's work, his seminars, and the innovative solutions he offers, I've listed the links below. And don't forget, if you've enjoyed this episode, please subscribe to the Dose Podcast for more insights into how you can transform your sleep and elevate your life. Until next time, remember your pure potential if you change how well you sleep.